Thank you, David. All right, we're getting into our Healthy 8 segment this Thursday. We are talking about advancements when it comes to breast cancer care. Dr. Daniel Silbiger, is joining us from the Cleveland Clinic. He is an oncologist. He's here to help. I thank you for being here today.
Thank you so much for having me.
That's going to be the hardest thing I say this whole discussion. I'm very excited to speak with you.
Very good, yes.
Silbiger. And with your knowledge, I know that you are so aware of advancements, things constantly taking place in this world. And I think it's always promising and exciting because the breast cancer patients of today are not seeing what we saw decades ago.
Absolutely. And I think what the key message is we're really personalizing the care to each individual patient and the cancer that they have. Many patients, it used to be that they would get very aggressive surgeries with very complex radiation and chemotherapy and so forth. And that's just not the case anymore. We're really able to scale back what we're doing for so many women because we have so many more advances in research today.
And I know we discuss this a lot, but I don't think it can ever be addressed enough. The current guidelines, what are we looking at? Who should be making sure, especially, that they're getting maybe even extra screenings?
Sure, absolutely. Our current guidelines for the American Cancer Society is to start at age 40 to do those annual mammograms. Our other United States Preventive Task Force Services has also started us around age 40 as well to do that. I think most patients should meet with their primary doctors, their gynecologists, or even one of our high-risk breast clinic providers to really figure out what is the best cadence of how often they should get. But typically our patients should be considered once a year for mammogram. In terms of the high-risk screenings, we know that patients with dense breasts, as an example, those with family history of breast cancer or other prior biopsies may also need additional supplemental screenings, such as MRIs or perhaps whole breast ultrasound that can be included in that conversation.
And how do they go about that? Because I think a lot of women, I know when I kind of opened up about my journey, people would say, well, I didn't know that I could potentially get an MRI too. How do they ask their doctors? Because I think it starts with a risk assessment.
Absolutely.
And that risk assessment then can allow them to get this further. But there are women who will say they don't like the mammograms, or they worry mammograms could cause radiation that is unnecessary.
Sure, absolutely. I think the first point is that the mammograms continue to be that gold standard. We're trying to get all women to do those because that's the one that has proven to save lives. And also, we not only with mammograms try to detect invasive cancers, but also pre-cancers that could become a problem down the road. And I know you've opened up about your journey and the importance of detecting early breast cancers as well. But those supplemental imaging can be designed, those packages, either through gynecology discussions. There are high-risk breast centers, such as at Cleveland Clinic, where we do meet with patients and help get that risk assessment score, figure out where we're at on that spectrum of whether we should do a supplemental screening, because those are powerful tools as well.
And I was looking at this too, this breast computed tomography, where a patient is lying on their stomach. Is that still considered a mammogram that they would be getting?
No, that would be what it's like a CT. It's a CAT scan breast. It's not yet ready, what I would say, for prime time for screening, but certainly I know that many women are anxious about the discomfort that a mammogram could give to them. I always say we're spoiled at clinic that we have wonderful mammogram technicians that work with our patients to get them through that journey. I think open honesty with the technician is important when women are faced with their mammograms and issues with that. So those are our first steps, I would say, to still do the mammogram, but to look for other supplemental options as well. Certainly we can have discussions about that, but still the mammogram remains that standard.
Well, and I think too, just getting the word out there, people discussing this more, understanding the importance of this, seeing where the future is going and how promising it looks with new technologies. I'm sure there's constantly in the research world new things coming about to really continue to catch this at a very early stage.
Absolutely, and I think that is the powerful message. The sooner we catch these, the better. If we catch it at a pre-invasive state or an early stage breast cancer, we don't have to get as aggressive with chemotherapies and aggressive radiation courses and so forth. And I think that's the message to women, that those mammograms give that opportunity to catch those cancers earlier and offer and afford the chance for less aggressive treatments in the long run.
Now, I know mine couldn't necessarily be felt doing a self-exam, but so many women also find these early on their own, right? And the importance of doing self-advocacy work and making sure that you are doing what you can too as a patient.
Absolutely. Not just relying on that once a year check-in on a mammogram. If you're having changes in the breast tissue, asymmetry, a new lump or bump, there's drainage or swelling in the armpit or on the arm, I think it's really important to bring that attention to the healthcare provider, and we should act on that. And the sooner we catch things, the better, ultimately.
That's always the case, and I appreciate you being here. I thank you so much for your wealth of knowledge you've just shared with everyone. We're going to continue this conversation for our Healthy Aid a little bit later on with a dietitian, talking about some things that we can do to make sure that we're eating right, especially when we're going through even treatments to just keep our bodies healthy. So